Hi, my name is Brian O'Rourke. I'm an occupational therapist and founder of Logic Rehab. Today, I want to start a discussion about the role of OT with cognitive behavioral therapy. CBT is a great evidence-based protocol, and it's been shown to be effective with many mental health conditions: anxiety, depression, PTSD. So I'm going to talk about how I use CBT with my clients with these disorders, and I'd love to hear from you about your thoughts and experience with CBT in your clients. I want to start with how I explain CBT and my role in the process to my clients. This is adapted from Changeways, the CBT for depression protocol, that I used to use in a group therapy scenario when I worked at the Burnaby Center for Mental Health and Addiction. So let's head over to the desk and I'll draw out the CVT Triangle that I use when working with my clients.
So this is called the CVT Triangle, and I've written out the elements of our human experience. So our thoughts, what we think, our feelings, what we feel, and our behaviors, what we do. So these are all connected. They are influencing each other at all times. When one changes, they all change. So the problem begins when one side is negatively affected. It can create a downward spiral. So let's give an example. Let's say someone loses their job. So their behavior has changed. They're not going to work. They may have negative thoughts as a result about the quality of their work, why they were let go. This can lead to negative feelings of self-worth. These negative feelings can potentially reduce their motivation to look for another job, and that idleness can create more negative thoughts, so the downward spiral continues. How do we stop the cycle? At what point in the triangle is the best to stop that downward spiral? So probably the hardest to change is your feelings. You can imagine that just willing yourself to feel better or saying, I'll feel better tomorrow, is not very effective. And another option is changing your thoughts. You might have had negative thoughts in the past where you told yourself to stop thinking like that or stop thinking a certain thing. But you may have found it's difficult to just stop a thought from entering your head. Although it is possible to, over time, change how you think about something, and analyzing your thoughts is something that we'll be working on as well, and something also you'll be working on with your counselor and psychologist. But really the easiest place to break this downward cycle is with your behavior. Anxiety, depression, they tend to sap energy and motivation. So even though you might know what you need to do, you might not be able to bring yourself to do it. But unfortunately, that energy, your interest, the drive, it won't come back on its own. So you need to stoke it like the embers of a fire, adding little bits of fuel at a time. So that's something I'd like to help you with. Supporting you with that it's part of my role as an OT, and helping you set up a structure to take small positive steps with your behavior and give you the confidence to do more, and helping you develop a sense of momentum. So using the same concept, you can actually use this triangle to create positive change, creating what I like to call a recovery cycle. If we take the example of our person who lost their job, perhaps through small steps in their behavior, they start volunteering, and this leads to positive thoughts about their ability to be productive and rewarding feelings, and maybe they're feeling better a little and start exercising, and then that's leading to thoughts about their ability to do different jobs, and they're feeling fitter and stronger, giving them the energy to perhaps find a new job. So in this way, they're spiraling upwards towards recovery.
So this is where I think OTs really excel with CBT, is behavioral activation and providing structure and goal setting to help clients build confidence in getting back to their occupations and ADLs. I heard a great quote that says, you can think yourself into feeling worse, but you can't think yourself into feeling better. So I agree, it's really what we do that makes us feel better in most cases. And this is where I tend to focus my treatment. So part of this might be an active rehabilitation programs with a rehab worker or a kinesiologist. Exercise is another intervention that's been shown to be as effective as CBT and almost as effective as even antidepressant medication. So as an OT, supervising an active rehab program is something I try to include in the treatment whenever possible. I also use a thought reaction record with clients when things go wrong, which is another great CVT technique. Stay tuned for more videos where we'll cover these techniques I just touched on and some other specific behavioral activation and thought processing treatments for OTs. Thanks.